New this morning, Connecticut Children has agreed to end pediatric gender-affirming care after a settlement with the Department of Justice. Your reporter Taylor Knight live outside the hospital in Hartford, sharing what we know about the change and what this could mean for patients and their families. Taylor.
Well, Connecticut Children's behind me here is the third hospital to reach an agreement with the DOJ and the Trump administration. This comes just about a year after the hospital said that it was ending gender-affirming care here because of disagreements with the federal government. Connecticut Children's has agreed not to perform gender-affirming procedures on minors. According to a statement from the Department of Justice, that includes administering puberty blockers and hormones to and performing surgeries on children under 18. Connecticut Children's has also agreed to pay a monetary penalty and will dedicate an additional $500,000 in medical care for individuals having to live with the, quote, harmful consequences of gender-affirming care. That's according to the DOJ. Last year, the Trump administration issued an executive order to end gender-affirming care for patients under 19 across the country. Federal funding cuts were threatened if hospitals did not comply. But gender-affirming surgeries were found to be extremely rare among transgender and gender-diverse minors. A Harvard University study published in JAMA Pediatrics back in 2024 found that less than 0.1% of children 8 to 17 with private insurance received puberty blockers or gender-affirming hormones between 2018 and 2022, and 0 surgical procedures occurred in minors ages 12 and younger. We have contacted Connecticut Children's for a statement about this agreement with the Trump administration. As soon as we hear back from them, we will bring their statement right to you. Your reporter live in Hartford, Taylor Knight, Channel 3 Eyewitness News.
All right, Taylor, thank you.